Welcome back to the Derm Club podcast. Today we have Dr. Kvedar with us today. Telemedicine is one of the most important technologies in modern healthcare. In certain circumstances, it allows for the delivery of care with high quality and minimal difficulty. Telemedicine has clearly been helpful in dermatology, where many conditions can be treated remotely. The digitization of dermatology will become increasingly more important, but we still have a long way to make it a truly seamless interaction for our patients. To explore the future of dermatology, technology, and telemedicine, I am excited to introduce a world expert at the topic, Dr. Joe Kvedar. Dr. Joe Kvedar is a professor of dermatology at Harvard Medical School, the past president of the American Telemedicine Association, past chair of the American Academy of Dermatology Task Force on Telemedicine, and vice president of Connected Health Partners. He is internationally recognized for his leadership and vision in the field of connected health, having written over 100 publications on the subject and authored 2 books, The New Mobile Age, How Technology Will Extend the Health Span and Optimize the Lifespan in 2017, and this book that I'm holding here today called The Internet of Healthy Things, which was published in 2015. Dr. Kvedar, it is a pleasure to have you as a guest today on the Derm Club podcast. Welcome.
Thanks, Hannah. It's great to be with you.
Thank you so much. We'll start off by talking about your first book, The Internet of Healthy Things. It came out in 2015, and as we know, since then, we've had a lot of progress. Can you share with us how you've progressed since you published this, since this chapter came out and this book came out, and especially as it pertains to the field of dermatology?
Sure, it is amazing to me. Someone mentioned to me the other day that it had been 7 years. It's not quite 7 because it came out in the fall, but call it 6 plus change, and it doesn't seem that long. On the other hand, the reason it came up in this conversation that I was alluding to was because many of the things that we predicted as future in that book are now present, which is very exciting to see. And you know, the rapidity or the pace of change in technology and healthcare is growing. Some of it was, of course, because of the pandemic, but there are also other factors. So the biggest, I think, theme of that's focused on in the book, and there are many, but the biggest one that's rapidly moving is this notion that we can use artificial intelligence to gather information about people, and whether that be through your mobile device or devices that you wear, other things about you, things like the weather report. There are amazing data streams now that can converge. And of course, in retail, this is done all the time, right? You practically know what you're going to buy before you know you need it, because Amazon and others are so smart about your needs. With that same kind of concept, can we predict health events and, more importantly, motivate you as a consumer to act more in a more healthy way? And we wrote about that. The first chapter is kind of cute. It's a day in the life 5 years ahead, I think. So that would be 2020, with a guide, a virtual guide called Sam, and he guides me through my day and sort of reminds me not to eat too much and to exercise more and things like that. And as I said, now there are products on the market that do exactly that. So that's the overall big picture. I think the dermatology part's a little more nuanced, and the application of artificial intelligence in that context, especially with respect to patient care, is a little more nuanced. One of the things that is a really important point that we stress in the book is so much of a healthcare cost and so much of chronic illness are lifestyle choices that involve parts of your health that you don't feel, like high blood pressure as an example. You could have a systolic blood pressure of 180 and never know it. Whereas in the skin, most of the time we either see or have symptoms. So it's less, not always, but it's less of a challenge to motivate our patients in the world of dermatology. And that's one of the reasons I went into the field, than in, say, internal medicine, when you have to say, oh, your blood sugar's up, and yeah, but I don't really want to take these medicines and I don't feel bad. And so in dermatology, most of our patients are more motivated. So really it turns around into how can we use the tool more from a provider perspective? That is, one of the things that's fun about dermatology is we see some pretty unusual things. And if we were able to, when that person comes in with an odd looking rash, or it's just not quite right, you can't put it together, the biopsy and the skin findings don't match. If you were able to go to your computer and have the computer spit out 10,000 of these happened around the globe, and these were the predictive aspects of those. In other words, you're not alone. That would be incredibly powerful. And artificial intelligence has the capacity to do that for us. So those are some thoughts about how the book's progressed and about how it's related to dermatology.
Yeah, it's really amazing because it almost seems like it seems like you were ahead of the times, but I think that the pandemic especially has accelerated that. So it's really quite incredible. And, I keep seeing in terms of wearables, like the other day it was on my iPhone and I always track how many miles I did that day. And I saw it said like, for my balance, it was like I was in the okay zone and like my predictability to fall. And I just said, wow, this is like really amazing. And, people use their iPhones all the time and they're on them constantly. So the things that can be tracked in terms of our health is really like quite impressive.
Extraordinary, yeah.
And then I, of course, understand what you mean when you say with dermatology, like people are maybe more motivated. It almost seems like you have to see it to believe it. And in dermatology, if you see it, so people are more motivated, and aesthetically, it's more pressing to get it fixed. So we know that telemedicine has certainly impacted dermatology. So for instance, I can talk about my own experience when I was a fellow and the pandemic hit. I spent, our clinics closed down, and right away we merged onto using telemedicine, and all of our clinics became virtual. And it was really amazing. I actually felt like I was seeing more patients in a day on telemedicine and working harder than I was in the clinic, which had its ups and downs. You can see more patients, but maybe the doctor is getting a little burned out. But there, I did see, it had its benefits and it also had its weaknesses. The benefits were that it's so convenient, and you can see a patient. We had patients who had certain cancers who needed to be talked to often, so we could talk to them every other day, especially if they had questions about their medicine. But then in terms of saying a patient who had needed a full body check, they would go into the bathroom and they would say, okay, doctor, I'm in the bathroom now. Here's my back. I have a mole on my back. So I know things will improve in terms of photos and making it more mainstream so that they're more consistent. But do you believe that teledermatology is a trend that's going to continue? And what needs to be improved?
Yeah, there's a lot in there. So let's try to unpack it and see if I can make some sense out of it. It's a complicated answer, especially in the field of dermatology. And one of the reasons for that, I guess I'll start with the reason I say that is because in our practice, in the office, forget about telemedicine for a minute, we do a lot of different things. Yes, we do a skin exam. Yes, we look at something. There's this concept, I'm sure you've heard people talk about it in your travels as well, called a doorway diagnosis, where you walk in and you know exactly what's going on before the patient speaks, right? So we do have those moments. We also take care of some conditions which are very reproducible, like acne, patients on Accutane. We have a lot of patients that are patients with psoriasis and atopic dermatitis that are doing quite well on biologics. So there are aspects to our practice that are very routine, where it's very almost algorithmic, the decision-making. Yes, you need your annual TB test, but everything's going well. We're going to renew your Humira, things like that. Or again, walking a patient through the month-by-month treatment for acne with Accutane. With that said, there's a whole lot that involves things like doing a punch biopsy or freezing actinic keratosis or other things that are very physical in nature. And it's very, I think, hard for most dermatologists because almost every practice that I know about is a high volume, efficient practice. So to sort of stop and carve out just the evaluation and management part is difficult. Now, so I'll just leave that for a minute. I'll come back to it. The second thing to say, though, is that patients inevitably love this. And I stack my telemed visits on Tuesday afternoons now for a couple of hours. And at least one a week says to me, "That's it? Really? I'm done? What a waste of time it would have been to come in the office." Mm-hmm. And so they, you know, we've trained people to think they have to go through a lot to get service from us. I think we need to get beyond that, not just in dermatology, but in all healthcare delivery. So for those things that I just mentioned, or whether it's a refill of something or a quick, and by the way we do it, which I think is also very effective, is patients submit images through our patient portal, and we call them and have a audio only call. Hopefully that continues to be reimbursed because it's so much more efficient. And as you know, the real information is in those still images. So for a certain group of conditions and indications, it's great for both doctor and patient. And I actually, at one point, working with some of my colleagues, we put those together into a sort of a workflow for triage staff to handle. When someone calls now, it's not as simple as saying, "Okay, Dr. Kvedar has an appointment at Tuesday at 4. Should they go to Telemed? Should they go in the office, et cetera?" And we have to train our staff around those issues as well. So it's evolving. The one thing I would also say is that it will go rapidly down to what it was before the pandemic if we don't continue to pay for it. Right now we're in the public health emergency and things are doing well, but if the government doesn't act and the private payers don't come along, then it will go back to a curiosity very quickly. So we have to watch out for that. What needs to be improved?
Oh, sorry to interrupt. Are you an advocate for, obviously you're an advocate, but do you have any discussion with the government or the health insurance payers about, policy around this?
Yeah, right now I'm the chairman of the board at the American Telemedicine Association. So it's a real opportunity for me to be influential. The person who oversees policy, and by the way, we just launched a 501c6, which is an advocacy focused group. If you all know the American Academy of Dermatology and the AADA, it's a similar structure. It's called ATA Action, and Kyle Zebley is the leader of that. He's also the VP for policy at the ATA, and so I have regular calls with him. I work with our CEO, and we are really advocating for the government, particularly the federal government, to make the changes that came out in the pandemic permanent. And I think they will, but as long as the public health emergency is in effect, they probably won't, because they're very deadline driven. And as you read in the newspaper, they're grappling with other problems right now, and they can barely agree on what time of day it is. So it does have bipartisan support, and it will happen. But in the meantime, we have to sort of really limp along. So back to your question about what needs to be improved. It is really about, to me, it's about the imaging, not only the quality. I think the scenario you alluded to where someone is in the bathroom naked, shining a camera around is really not ideal at all. I don't know if it ever will be ideal. Now, one of the things that we sort of glossed over was that from March through June of 2020, when we pretty much didn't see people in the office unless they were really on death's door, we did stuff like that and we got by, and people sort of, but that is not the ideal use of telemedicine. The ideal use is I have a single lesion here, or I'm an acne patient, or again, there's a half a dozen use cases. For someone who needs a full skin exam, they should come in the office. I mean, it's really that simple. So it's evolving, and the last thing I just want to emphasize, when you said, will it become a routine part? Yes, it will. It depends on how we pay for it, and it depends on how we focus those use cases that I mentioned.
Do you think that every practice, like once we establish the policies and how we're going to be reimbursed, do you think every practice will have one aspect of their practice focused on remote analysis and care going forward?
Yeah, that's a great question. So I've been in academia my whole life. I've not been in private practice. And I think there are many kinds of dermatology practice. There's the sort of general practice now, and I think most of those people do a little bit of cosmetic work. They do a little bit of surgery. They do a little. It's a very broad practice, and I think for those folks, probably yes, because they'll find a way to, as I said earlier, if you carve out those 4 or 5 things that I mentioned and do them, and you bundle them into a time spot, it's very efficient, and that way you can open up your schedule for someone who needs a Botox or a filler or what have you, right? So if you think about it in that way, it can be very ideal. Those practices that are, like that are mostly cosmetic and mostly spa, et cetera, maybe not, because the people really need to come in for those services. Now, maybe there's a bot that does before and after pictures on their website so patients can get a sense of what they'll look like. That's a little different than, I would say, telemedicine. That's more artificial intelligence and marketing. So I think not every practice, probably. It's one of the things I keep emphasizing, and if we go back over time, a lot of us that were advocates or evangelists always made the case that this was better for our patients. And I still believe that. But the sad, maybe, or just the truth, let's not call it sad. The truth is that the healthcare delivery system, at least in the US, is not set up for that. It's set up as a business, and doctors will look at the business opportunity and decide whether they're going to deploy this or not. The last thing I want to mention, though, is the threat of the companies like Roe, Hims, Nurex, and others. And I say threat, they're providing a great service, these companies that are doing online acne, but dermatologists may perceive that as a threat because those patients are getting something, in the same way that I mentioned, my patient said to me the other day, is that all? That's amazing. These people are getting those services from companies online and not going through all the hassle we put them through. So it may get to a point where telemedicine is what we call a stay in business process for dermatology, in order to continue to bring in people to your practice who will eventually need those other kinds of services like fillers, like Botox, like lasers. You need to offer this service to stay competitive. I would love to see that because I think it's better for our patients.
I agree. I also think, like you said, there's obviously circumstances where it's better to come in, but for like follow-ups, there's no reason that like a patient should have to commute into the office. Also, I don't see why the government wouldn't support it if it's low. It really lowers healthcare costs.
Well, it's an interesting digression for just a minute to say that there's the evidence of lowering healthcare costs is quite mixed. And I would go back and say it depends on how you implement it. Like any other service part of healthcare delivery, it can lower or raise healthcare costs. there is some worry, I believe it's misplaced, but there is some worry that because it's so easy for patients to get these services that they'll overuse them. And you and I both know people, generally speaking, have a life. The last thing I want to do is just phone up their doctor 50 times a day. But that sort of nonsense is out there. And that's one of the reasons that our colleagues and elected representatives in Congress are not pulling the trigger more quickly, because everything has to be scored by the Congressional Budget Office. And unless they do it thoughtfully, it's possible that telemedicine will score high and they won't be able to continue to support it. So that is going on in the background. It's not straightforward.
I also see it as like a triage that patients can really say, like, you can list their urgency and their need to come in people are on a 6-month waiting list in certain areas of the country to see a dermatologist. So
Yep. I agree with you
it
completely.
can open access to many patients.
Yeah, and that's one way we use it a lot, is that people, I'm sure that, I don't know this, but I'm sure they phone in and our patient services coordinators say, well, let's see, we have a spot in like right now is February. So I'm probably, if you just don't know me, or, I'm probably booking in June, right? So, and then they'll say, but he has telemedicine if you want to try to fit that in. Usually the patients go for it. And happily, most of the time we can solve their problem. Sometimes they really do need to come in. What's interesting about that model is, if you get to me on a Tuesday afternoon with, let's say, a changing mole on your forearm, and I say, yeah, that really should come in, I'll find room to fit you in. So you've achieved your goal of quicker access and through the telemedicine route.
Are there tools or remote diagnostics that need to be introduced to make a dermatology visit better?
Well, people talk a lot about dermoscopy, and so I think the use of telemedicine for pigmented lesions is still somewhat controversial. There was a time when those of us who are in the field sort of said, no, I think if you have pigmented lesions, you should come in. I think that's changing. And it would be incredible if there was an easy way for patients to capture dermoscopic information about their moles as they send in images, right? I think it's a long way off to think about how that would get into everyone's medicine cabinet so they can do their skin exam that way, but would be good. I think the other, which is probably closer at hand, and I like the analogy when I get this, every now and then I still get a physical check in the mail, if you can believe it. And I have an app, and I'm sure you do too, on your phone, that allows me to take a picture of that check and deposit it in my bank account. And those apps are very good at saying, no, center it here, move it closer. If we gave patients that kind of tool for them to take a really good image of their skin, because I don't know, half the time maybe they don't know what they're doing. And even with the guidance, your eye and my eye looks at it differently than their eye. So I think we could set some software up that would enable people to take a higher quality image, maybe 3, one far away, one close up, et cetera. That would enable us to be more diagnostic more of the time. That would be really helpful. The other, I think, thing that for some use cases would be to have home lab testing. Would be interesting to have home T-spot tests for people that are on biologics for psoriasis as an example, or maybe home lipid and liver functions for our Accutane patients. So they don't need to go anywhere. They can collect a drop of blood, and these tests can show up on their phone and they can share them with us. Those kinds of things would be helpful. So it's really thinking about how to make that experience complete for the patient and more efficient for the provider at the same time.
Yeah, so you mentioned the Accutane. I know during the pandemic, of course they have to come in, the patients have to get a monthly pregnancy test before they get their next prescription. But during the pandemic, they were allowing patients to do the pregnancy test at home and send their results. Do you think that will continue after this emergency? Is it over, or it's going to return to
No, I
coming back
hope
in?
so. I pledge is a beast unto itself. They've just gone through a very painful upgrade. We probably don't want to spend a lot of time trashing iPledge. It's a well-meaning system. The idea of having a registry for these patients and making sure they don't get pregnant is well meant and well intended. It's become very bureaucratic, and one of the things that they've actually threatened to do with this upgrade was to go back to having serum pregnancy tests. So I don't know what will happen. I do. It's sad to say that we have seen some patients that have misused the system. We now ask them to take their pregnancy test, put it on a piece of paper with their name and the date on it, because we've seen some people downloading images from the internet of what a pregnancy test looks like. So whenever you get something convenient, people can misuse it. So I think a way to reassure us that they really are taking the test and it's negative, I would think it would keep it because it's so incredibly convenient. But like I said, the iPledge people seem to have a completely different view of the world.
Yeah, I used to think it was so crazy. Like, you would have a patient, they wouldn't even have to come in for any other reason, just to have a pregnancy test. I said, this is not even a good use of our resources.
Right.
So are there any improvements that you know of at this time that are in the pipeline for Teledermatology or Telediagnostics?
Well, we alluded to it before, but I'd come back to AI. I'm very pleased with the Academy's approach to artificial, and I guess they call it augmented intelligence, but whatever you want to call it. The idea of having large data sets and having software learn from those data sets and predict things about similar people. That's what AI is essentially. And it can be applied in dermatology. They're the ones that make headlines are the idea that you could maybe take a picture of a mole and that the algorithm would tell you if it needs to be biopsied or not. I'm not sure that that's going to be the first thing we see come out in the marketplace, because that's you're talking about melanoma there, and I think most folks would be more comfortable that a human being makes those decisions. But there are other ways we can use the tool. As I said earlier, there's ways to use it as decision support. There's ways to use it in all kinds of ways. Again, it's about predicting from large data sets and then taking whatever you have in front of you and saying, how does what you have in front of you match those large data sets? How can we predict? The analogy, of course, being you watched this movie, Netflix thinks you might like that movie. It's really the same technology. So I think that's really the next phase. Sure, we'll get better imaging, but I come from a place where when I started doing this work, and it was in the early 90s, we were able to prove that with a 1 megapixel camera, we could do diagnostic imaging. So sure, we can get better at imaging. We can get better, as I said, at having our patients take better quality images. But I think really it's the application of AI that's going to be the next big thing.
So you mentioned AI, and I know that you're always forward thinking, and this might be a little early to ask, but do you think that the metaverse will play any role in treating dermatologic patients?
Sure, I do, and I love the question. It goes back to some basic things that maybe aren't so much particularly dermatology specific. That is that people in augmented or virtual reality settings have better pain control. They have better anxiety relief. A lot of the conditions we treat have tremendous social stigma. I'm sure there are going to be ways to help people therapeutically with that sort of thing, et cetera. So I see a lot of opportunities in general. I don't know that how many of them are specific. I'm trying to think of anything that would be diagnostically helpful, and I can't off the top of my head, but I think in terms of therapeutics, And remember, so much of dermatology has an overlap with behavioral health. And so teaching people, using tools like that to help people with prurigo, not scratch. I mean, there's a million different ways I could think of using it. So it's, but more on the therapeutic side and more on the side of dermatology that blends with behavioral health.
Well, thank you so much, Dr. Kvedar, for joining us today. We're excited to see more of an impact on telemedicine and the dermatologic patient care. And I know that you contribute to this field. So we thank you for your work, and I hope it continues, and I'm excited for the future.
Well, I was very excited to be able to chat with you, Hannah, and I look forward to future collaboration.
Thank you. I hope you enjoyed this episode of the Derm Club podcast. If you found the discussion today to be valuable, please subscribe and share. I look forward to seeing you in the next episode as we continue to delve into dermatology and skincare with the world experts.